Brian Besser, Salt Lake City's DEA district agent in charge. Thank you so much for being part of Three Questions.
My pleasure, sir.
We've got a real problem in the Rio Grande district of Salt Lake City. We had a murder there today as we are recording this interview, and 3 people hurt. What is going on down there? There's a lot of illicit drug activity, but where does the problem really lie?
Well, it's a good question, Bob. You know, there's a lot of factors. This is a very variegated issue, if you will, but it really isn't that complex. We have heard a lot of people talk about the homeless problem per se, and I don't like to focus on the homeless aspect, but on the lawless aspect. I think it's, again, not happenstance that the genesis of a lot of this petty crime and the small crime that goes on happens around the homeless population. And what we want to do is we want to focus on the crime. We want to focus on the lawlessness that's going on downtown right now. You could go downtown at any given moment right now, down by Pioneer Park or the Rio Grande area, by the Road Home Shelter, and what do you see? You see almost an open-air drug market, if you will, a free-for-all. You've got everything from vagrancy to public drunkenness to lewdness to thievery. I mean, I can go on and on. There's spokes of an entire crime wheel that's going on down there. And when we have unabated crime, when you have an area where small, minor crime is not being enforced, then the law becomes of no consequence and people just ignore it. And that's what's going on down there. We have to get back to holding people accountable to smaller crime.
What kinds of smaller crime need to be enforced in the Rio Grande district to bring an end to this lawless problem that you're referring to?
I would almost say any and all crime to some degree. I mean, we can't turn our heads to any type of crime that affects what we would call our quality of life. You know, I go back to a previous conversation we were having. I was in New York City pre-Rudy Giuliani, back when New York was kind of in its heyday of having a lot of problems. And Mayor Giuliani came in and he instituted, for the lack of a better term, the broken windows theory, which everyone's familiar with. The idea of where law enforcement and community first responders started saying, we're going to pay attention to the little details. We're going to get back into the weeds here, and we're going to start paying attention to these nuisance crimes, these crimes of opportunity that are going on. And to be quite frank, they're bugging people. They're ruining our quality of life. We have to start addressing the littering. We have to start addressing the vagrancy, the panhandling, you know, fill in the blank. And we have to start addressing those, holding people accountable for them, where we do not want to encourage that activity. We want to hold people accountable for it and then move them on and move them out and restore those streets back to what they're supposed to be. You know, the streets are not a home. They're thoroughfares for people like you and me to conduct our business, to get from point A to point B safely, for people to feel safe. And when you can't do that, you've got a fundamental breakdown in society, and that's what you've got down there. We have not just homelessness, but lawlessness. Lawlessness cannot be ignored. It must be dealt with, and it must be dealt with quickly.
How much of the problem in the Rio Grande district and the area that we've been talking about in Salt Lake City, how much of that problem in the Rio Grande district is actually fed by illicit drug activity?
A lot of it. You know, a lot of people ask me, they say, you know, Brian, what do you do for a living? And I said, well, I work for the DEA. And they said, oh, you know, what do you do? And I said, well, I work on drugs, drugs, or drugs. I said, pick your choice. But the interesting thing about drug activity is it's linked to almost every type of crime you can think of. Drug activity is linked to burglary, robbery, prostitution, embezzling, disorderly conduct, criminal domestic violence. I can go on. You know, drug activity, again, it's almost like the hub of the crime wheel to some degree. So we can't divorce or separate drug activity and crime. They innately go together and they feed one another. So again, I've been telling people that it's, again, no happenstance that the cartels have taken a vested interest, if you will, in the Rio Grande area, because you've got a vulnerable group of people down there who are struggling with addiction and homelessness, but they don't care about that. They capitalize on the money that's to be made. And that's why they give the product out cheaply or freely to get you hooked, put that hook in your nose, if you will, and they reel you in, and then they create these problems. And that's what's going on down there right now. As you've probably paid attention, the Attorney General and myself recently announced a fairly large arrest takedown a couple weeks back. We arrested 35 individuals in that area down there. And these were not street corner Joes just out there peddling small amounts. These were large-scale bulk drug suppliers that were peddling Mexican and Honduran-sourced methamphetamine and cocaine into the Rio Grande area. We want to take off those sources of supply. That's on the macro level. But on the micro level, we still have to deal with the petty crimes, because that's what's breaking our society down. And you and I become victims to that.
So, in other words, the DEA, the Attorney General's office, and I would imagine Salt Lake City Police all have to work in concert to bring this problem to a close, or at least reduce it.
Yes, sir. And I'm so glad you brought that up, because we won't point a finger at any one particular individual, organization, agency. It's a collective effort. You know, we can't say that this problem, you know, we point the finger and blame one particular organization or an agency. We won't do that. It's a collective effort, but we have to take care of it somehow. You know, this has to be dealt with, and it has to be dealt with now. Like Speaker Hughes is saying, we're done talking. It's time to act, because the problem continues to proliferate to a point where it spirals out of control and we have anarchy. What we have down there now, I think, last numbers, we got about 2,100 people down in the Rio Grande area who are, quote, homeless. But are they?
How many of the 2,100 people in the Rio Grande district are not really homeless, but are opportunists there trying to make a buck through criminal activity?
Yeah, it's hard to quantify the numbers, and we really can't, but we know that the one attracts the other. You know, again, the two dovetail together, they go hand in hand. When you have these, when we allow a situation like that to degrade and to cultivate downtown, the one attracts the other. So you have opportunism, you've got, again, petty crime, you've got people that continue to come to Salt Lake City because they realize that they can participate in this type of activity. You know, I like to, again, quote one of the sayings from a friend of mine, Jim Winder, Sheriff Winder, who said, when you throw bread to the pigeons, more pigeons come. When you give people something for nothing, more people will come who want something for nothing. It's time we have kind of a quid pro quo system where we want to help you. We want to be compassionate and discerning. We want to give you something. But in return, you need to give back to the community at all. And just because you're, quote, homeless doesn't mean that you don't have anything to offer. We need to make people, you know, reciprocate.
If you had to compare Salt Lake City with other major metropolitan areas like Denver, here in the West, like Denver and Phoenix and Boise, Seattle, Portland, Los Angeles, San Francisco, where does Salt Lake City fall in the severity of the homeless problem and the crime situation that surrounds that environment?
Well, as you know, I've lived in New York, Chicago, Washington, D.C., other places throughout my 26-year career with, in law enforcement. And I'm new to Utah. I've only been here about a year. And I'll give you a little anecdotal example of this. A year ago, I was driving into Salt Lake City with my wife and my kids in the car. And we're coming in from out east, and we pulled into a stoplight. And while we stopped at the stoplight, coming into the downtown area, first time my wife has ever even been here, she looks out the window and she said, "What is that?" And I said, "That is your welcome mat to the Salt Lake City area, the homeless problem." That's the first thing you see as a person like me coming into the city. And in my opinion, that is completely unsatisfactory. When you're coming into the gateway to a beautiful city like this, is that really what you want to greet your visitors with? And we were appalled, to be quite frank, we were appalled. We've been in major metropolitan areas before. In my opinion, and again, this is my opinion, I'm sure many people will differ with this, but the problem here is pretty egregious for a city of its size. And everyone, especially the community members around the Rio Grande area, no one's going to argue with me that it's out of control, and it needs to be addressed.
For those who don't know or understand, when we say opioid epidemic, what are we talking about?
We are talking in the 2010s where the use of synthetic opioids, drugs which are very powerful central nervous system depressants, narcotic analgesics, they have just taken off and skyrocketed in use. Give you for instance, here we are in 2017. In 2016, We lost 57,000 people to this epidemic. Now you take Lavelle Edwards Stadium at full capacity on a game day, pack it to the gills, that's around 57,000 people, and wipe that off the face of the map on a weekend. And that's the amount of people that we're losing to this epidemic per year, and it's growing. That was 2016 stats. We haven't garnered yet, obviously, 2017 because that's still in progress. But I do know we're losing roughly about 90 people a day across the United States, and that is even open to debate. Sadly, here in Utah, we're losing in between 6 to 10 people a week. 24 to 30 individuals, 24 to 30 Utahns die because of the heroin opioid epidemic a month. And that is more than vehicle-related incidents and firearms combined. Can you imagine, Bob, if we were losing that many people to DUIs a month? You would have people up on the Capitol steps, right? But we're losing that many people right now to the opioid epidemic. And these are people who we never will see again. And it's absolutely tragic.
What is the genesis of the opioid epidemic here in Utah?
That's a good question, and it's hard to answer that. I know I've bounced around. I've dealt with my counterparts out east. I've dealt with my counterparts in the Midwest, in the South. And there's something unique to Utah to some degree. As I've talked to other law enforcement officials throughout the state, especially the guys and girls that have been on for over 30 years, I've asked some very, very pointed questions to them since I've been here. And all of them have come back to me and said this. They said, you know, Bri, they said, Utahns have been abusing prescription drugs for well over 30 years. There's almost like an undercurrent in this state, if you will, where your conventional street drugs like heroin, you know, methamphetamine, cocaine, the drugs that come in a baggie, those are bad. Those are naughty. We don't deal with those. But if it comes in a bottle with a label on it from a pharmacy and a doctor's approval, well, that's fair game. And sadly, that is what's being voraciously abused within the homes, the households throughout the state, and we see that. I see that, you know, and it's very troubling.
Recently, the DEA and other local authorities took down 2 major drug operations where people were manufacturing pills. And we were told that these were big deals. Mm-hmm. When you take down an operation like that, how much good, how much of a dent does it really put in the overall problem?
Great question. I'll give you a little peek through the keyhole here. We're going back, for instance, to the Aaron Shamo investigation in Cottonwood Heights. Here you have one individual who was manufacturing counterfeit fentanyl pills, counterfeit pharmaceutical pills, but they were laced with fentanyl and other assorted binders. As we've stated at previous press conferences, Mr. Shamo was dealing with over 8,000 people across the United States, the domestic United States. His packages, he would manufacture his drugs here in Utah, in Cottonwood Heights, in his home, and then mail those packages all across the domestic United States to 8,000 different recipients is what we've been able to identify so far. That's just 8,000 recipients. That doesn't necessarily mean it's only 8,000 people. It's families, businesses, schools. Those drugs were going all over the place.
Other distributors?
Absolutely, other distributors. So the impact of taking this one rogue manufacturer down was huge. We're still trying from an investigative standpoint through the United States Attorney's Office to ferret out the amount of people who may have died from this. And we know that several have. So again, that's a very egregious crime. You know, I liken it oftentimes to an individual who could so coldly and callously walk in front of a crowd with a loaded shotgun and pull the trigger and then just walk away. He doesn't know who he hit. He doesn't know how many he hit, but he knows he hit somebody and just doesn't care. We call it willful blindness, if you will. And so these counterfeit tableting operations are extremely volatile, extremely dangerous. They're one of the most dangerous environments that my guys go into. I worry for them, I do. It's just that dangerous because of the fentanyl problem. Fentanyl is extremely deadly.
The major illicit drug operations that you have recently taken down in Utah, why are they in Utah? What is the environment here that makes it possible for them to thrive?
Well, I won't speculate on that, but I will say this. This is the universal denominator. It's a profit-driven and a greed-driven business. We're talking about millions of dollars in cash, millions of dollars in proceeds that are generated from a very, very nominal investment. And sadly, this is what lures people into this. They realize that there's a lot of money to be made, and it's off the backs of innocent people, and people just fall into that trap. You know, are there more of these operations in Utah? I'm certain of it. Are we working hard to, again, identify those and bring those individuals to justice? Yes. Do we want the community's involvement and help in that? Absolutely.
How much do doctors contribute to the opioid epidemic? And how much does the pharmaceutical industry contribute to the opioid epidemic?
Everybody plays a role. Anybody that handles or has the lawful right to deal with Schedule II narcotics has a role. Your role can either be to judiciously and discerningly prescribe those narcotics to your patients. We prefer that practitioners err on the side of caution. You can always give out more, but it's hard to take it back. You know, so we look at the doctors, we look at those, we want to come alongside of those who are being very discerning and judicious in their practice. But we also give a word of warning to those practitioners who are overprescribing, and they know it. There's money to be made there. And sadly enough, we've dealt with many individuals who they get hooked on these opioids on the very first bottle. Within 5 to 7 days, they're immediately hooked and addicted. We want to monitor those doctors, and we do. And if you're overprescribing, knowingly overprescribing for profit, we're going to find you and we're going to bring you to justice.
What about the pharmaceutical industry itself? Is it warning the public enough about the dangers involved in opioid use and abuse?
I believe the pharmaceutical industry has fallen short historically on that. With the advent of the opioid epidemic and the burgeoning epidemic sweeping across the United States, red flags have gone up, and the pharmaceutical industry, I believe, is taking some significant strides to raise the flag, so to speak, and to try to come along law enforcement and practitioners to help in this. I don't believe we're quite there yet. I believe there's a lot of responsibility there. Again, we're dealing with a business. There's a lot of money to be made. And sadly, Americans have an insatiable appetite for drugs. We live in a pill for every ill society. That's the paradigm, Bob, that we have to change. We have to change the way Americans think about pain, the way we think about medication. That has to change, or we will not see any effectual change in this epidemic at all.
We've heard the term synthetic drugs quite recently, a lot recently. Tell us what those are and how dangerous are they?
Well, it used to be years ago you had what was called opiates with a T and opioids with a D. You know, one is, for the lack of a better word, kind of natural, plant-driven. You've got like heroin, morphine, those come from the poppy plant, you know, when you boil it all down. Those would be considered opiates because they're natural. Opioids are synthetic or man-made. You know, an opioid would be something like oxycodone, oxycontin, hydrocodone, if you will, any of the big Schedule II narcotic analgesic painkillers. They're extremely potent. They're extremely addicting, which is the biggest concern for us right now. And then when you start getting into the more powerful synthetic opioids, like right now we're dealing with in the news, fentanyl, and even carfentanil, which is extremely potent. Fentanyl, for instance, is 40 to 50 times more potent than street-level heroin. And it's 100 times more potent than just regular hospital-grade morphine. So we're dealing with something that you may not get a second chance to abuse. And that's why, again, these counterfeit tableting operations are so egregious, because one individual may buy a counterfeit pill on the street. They think they're getting something pharmaceutical grade. It looks like it. It's stamped like it. The naked eye can't really discern the difference between the two. You buy it on the street and you take it, and you may be the unlucky person who gets what we call a hot load, and you're going to die within a matter of minutes. And that's what we're seeing right now, where it's being abused.
Over a lifetime of law enforcement, it just must break your heart to see the lives lost and wasted. How does that affect you personally?
I'm so glad you asked that, Bob, because a lot of people look at law enforcement, number one, like we're so calloused and so uncompassionate. And that's the furthest thing from the truth. It breaks my heart to see families and kids and homeless people get addicted to drugs. It does. I take the greatest joy in my career when I can come alongside someone from almost a diversionary or a demand reduction standpoint, and I can help them before we get to that point. That's honestly what one of DEA's missions is to help prevent it before it starts. Yes, we have an enforcement angle. Yes, we have the capability to enforce the law, but that's not where our passion, lies. We want to prevent the problem first, and sadly, we have the right to deal with it after it happens. We want to deal with it from a treatment angle as well, but when a law is broken, again, like we said in our previous conversation, there still has to be a penalty there. You can get forgiven sometimes for the infraction, but you deal with the consequences forever, and that's what we're trying to deal with.
A lot of times, addictions of any kind, whether it's to drugs or pornography or or food or whatever it might be, addictions of any kind are actually a symptom of a much deeper problem.
That's right.
And when we're talking about drug addiction, isn't the root cause of drug addiction outside the scope of the DEA?
It is. People self-medicate for a variety of reasons. I've just about heard it all. And again, I have compassion for these folks. Everyone deals with their quote-unquote demons a different way. Our goal, again, from a law enforcement agency's perspective, I can't get into the weeds on that. When I go to a crime scene or a place where we're taking enforcement action, my primary goal as a law enforcement officer is to enforce the law. That's what I'm paid for. That's what Congress has mandated that I do. And that's what I'm going to do. But I'm not so cold and callous that I can't see beyond that to the human element and say, you know what, this individual maybe had a bad experience, or they're down on their luck, or they got injured and they accidentally got addicted. So we want to peel the veneer back on the human element, look at what's going on in these individuals' lives, and work with them on that. And we do. And we recommend to prosecutors, we recommend to treatment organizations. People are the #1 priority. They always have been and they always will be. That's the angle that I take here with my office. And again, yes, there's a law that we have to enforce, but there's people involved. And we want to deal, again, judiciously, discerningly, and compassionately with that dichotomy.
Recreational and medical marijuana are now legal in 29 states and the District of Columbia. These states have supposedly legalized this substance, but according to federal law, it is still illegal. Mm-hmm. How does that affect the way the DEA handles these situations with marijuana?
Well, it's a good question. Everything for us is based on what's called the CSA, the Controlled Substances Act. The Controlled Substances Act is, by statute, a law, and drugs are ranked by a scheduling. Marijuana is, and always has been, a Schedule I drug. What does that mean? The public oftentimes think that a Schedule I drug is ranked at the level of relative danger. And that couldn't be furthest from the truth. We don't rank drugs by danger. We rank them by their lack of accepted medical use and treatment. We rank them by their potential for abuse and addiction. And we take a look at those and we say, where does this fall? Where is this going to do the most damage to our society? So for instance, the FDA, the Food and Drug Administration, and NIDA, the National Institute of Drug Abuse, they examine, research, and conduct analysis on a drug. When they do that comprehensively, this is all based on medicine and science. It's very, very rigorous testing. It involves a plethora of individuals. And when that testing, again, is very comprehensive and it's done, they make their recommendations to the DEA. Those recommendations are legally binding to the DEA. And their recommendations, every single time this has been addressed, most recently in the fall of 2016, they came back and said, you know what? The science just is not there. We can't find an accepted medical use in treatment for marijuana. And it still has a very, very high potential for abuse and for addiction. We're going to keep it at a Schedule I. So because it's a Schedule I drug, the federal government realizes that, and we enforce it from that angle.
Anecdotally, there are lots of stories, and it runs the gamut from cancer patients to epilepsy sufferers and many, many others, chronic pain sufferers, who say that they do receive relief when they take medical marijuana. Is there a scenario under which marijuana would be declassified as a Schedule I substance?
Maybe in the future. The good thing is DEA is very progressive when it comes to this. Again, people think we're not. We have granted more licenses now for marijuana research than ever before. We've literally thrown it out there and said, hey, please, if you're conducting legitimate research, lawful and licensed research, we want to help you. We will get you the marijuana that you need to conduct that research. We're all ears. And, you know, if there is some type of medicinal value to this drug, we want to use it, we want to exploit it, we want to get it out there. But right now, the science isn't there. It may be down the road, but not right now. I know that's open to, again, argument and conjecture with a lot of folks. But again, this is what we do. The FDA has been doing this for every single drug for the last 50 years. But it's interesting to me that the only one people want a hobby horse is marijuana.
For those folks who find relief in using medical marijuana, regardless of whether it's legal to do according to federal law, can you give them any hope that they're not going to get arrested if it's legal in their state, and that someday the federal government will say, you know what, there is enough evidence there, even anecdotally, to indicate that we ought to give this another shot?
Yeah, and I think both of those scenarios are very viable. I really do. Research is more robust right now than ever before. People are truly trying to find out. We deal with that, for instance, with the CBD oils. We have a lot of individuals right now who are saying, hey, you know, these CBD oils right now are, we're seeing therapeutically that they've helped children, seizures, etc. Great. We want to encourage that if that's out there. The problem is we just have to make sure that the research marries up with the law, and things have to catch up in time. We're still kind of at the ground floor on a lot of this. But again, DEA wants to take a progressive stance. You know, the biggest concern we have is for the community at large. When laws are passed and enacted in the United States, especially from the federal level, it's for the good of the whole. You know, I view that the same as, for instance, like a DUI law. You have a privilege to operate a motor vehicle on the state road of Utah. But that can easily be taken away if you're infringing on that, if you're breaking the law, driving under the influence, because what you're doing is you're perpetrating your insobriety, if you will, on the rest of everyone that's driving, right? So what we want to look is we want to take care of the whole, the community as a whole. And unfortunately, not everybody views it that way. There's a lot of special interest groups and self-interest groups out there. We want to work with them. But we have to look at it from a macro level and not just a micro level. What is good for our society as a whole?
Washington State, Oregon, California, Colorado, and many other states in the 29 states that have legalized marijuana. How does the DEA enforce the laws in regard to marijuana in those locations?
Well, bear in mind, many of these laws in these states are voter and ballot initiatives, okay? They're not necessarily grounded in the medical and scientific research that's been done by the FDA, DEA, NIDA, etc. So we have to differentiate the two. Just because something passed by a voter or a ballot initiative does not necessarily mean it's good for everyone. It just means this is what everyone voted for. So the federal government takes that stance. We're going to enforce the federal law. We're going to do so in cooperation with state law, but sometimes the two connect, sometimes they are separated. We have to take a look, again, judiciously on how we deal with that. And unfortunately, there's a rub with that in several states. You know, when you take a look at the data right now, especially coming out of our sister state in Colorado, wow, have we seen a completely different paradigm over there. It's easier right now in Colorado to find a dispensary than it is a Starbucks or a McDonald's. That's how many dispensaries are in the state of Colorado. But when you take a look at the stats, again from our angle, on how the legalization of marijuana has impacted that state, I believe those statistics speak for themselves. And I, for one, at least from a law enforcement angle, am not overly eager to bring that to the state of Utah.
So what does the DEA do in that situation? You mentioned Colorado. What do you do? Does the DEA go in and close down dispensaries? Because we know federal law always trumps state law.
Great question. Always remember, when we're dealing with crime, there's always two sides to every coin. You've got a legitimate side and an illegitimate side. So for instance, what we oftentimes see, you may have a dispensary that is putting the, and this doesn't happen all the time, but we see this a lot, and you know, again, you have a dispensary where the lawful marijuana goes out the front door, but the illegal marijuana goes out the back door. And we deal with the infractions at the state and federal level, and if there is legislation that's been placed where a certain activity is lawful, we work with that state to ensure that there's some type of happy medium on the enforcement.
So if you go to Colorado and you're seeking medical marijuana, you can consume it there with a reasonable assurance that the DEA is not going to come and get you.
Every day. It's happening right now. But I can assure you, if you are trying to evade law enforcement detection for criminal enterprise, and you're trying to circumvent the state laws that are there, and many do, DEA will be on your shoulder to bring you to justice when it comes to that. And that's what we do. If you're a rogue manufacturer, if you're trying to circumvent the law, and that's what many do, we go after that.
Okay. Law enforcement has been engaged in what has been termed the war on drugs for a long time. In your eyes, what does a victory in the war on drugs look like?
Wow, that's the $10,000 question. You know, again, it goes back to this. Whenever there is a massive demand, there's going to be a massive supply. And America, like I said, has an insatiable appetite for drugs. We are one of the most drug-saturated societies on the face of the earth. Think about this. Americans comprise about 5% of the world's population. Yet we consume 25% of all the drugs in the world and about 98% of all the hydrocodone that's manufactured globally. So that should paint a picture. We are a very, very drug-saturated society. A pill for every ill society. To me, a victory in this regard, if you could call it that, again, this may sound somewhat self-relative, but this is my own personal opinion. A victory to me is where we as a society become responsible. We deal with pain responsibly, we deal with self-medication responsibly, and we start backing away from the abuse. And again, that is unique to each and every individual. Are we going to eradicate it? No. No. There's crimes that have been occurring since the beginning of mankind that we will most likely never stomp out. But again, there are certain elements here that I think we can mitigate and have some victories in. And again, we go into this opioid epidemic right now. We're right now in the full-blown epicenter of a burgeoning epidemic that's sweeping across the country. But let's rewind the tape back, say, 50 years ago. 50 years ago, you had a doctor in a white coat saying, "Your doctor smokes Camels. I recommend that you smoke Camels." But we changed that. We changed that culture. We started getting that out there that cigarettes and tobacco are harmful to your health. It causes cancer. In a society back then where everybody smoked, you know, again, there's a little hyperbole there, but everybody smoked. Now, smoking has become far more taboo. People recognize that it's not healthy for you. That same paradigm can change in the quote-unquote drug war. It's not easy. It's like trying to turn a very large ship one knot at a time, but I pray that we can do it a little bit. And if, at least in my short career, I can help save a couple people's lives while we do it, I'm okay with that.
In the past several months, there were two teenagers up in Park City who bought illicit drugs over the internet off the dark web and died. What emerging drug trends are you seeing right now that kind of parallel that scenario?
Another great question. We live in what I call the Baskin-Robbins age of synthetic drugs. There's 40 different flavors, and the flavors keep coming. Sad thing is the flavors get more deadly by the day. So these synthetic opioids that we're dealing with, especially fentanyl right now, is deadly in micrograms and milligrams. I know it's almost becoming a little cliche because many are getting tired of hearing me say it, but it's just 2 grains of table salt. If you spilled that shaker out on your hand, 2 grains of table salt is all it takes for a non-opioid user to be fatal. That's how potent these drugs are. That's a lot different than the conventional street drugs that mom and pop dealt with 40 years ago. This stuff is here, it's consistently being manufactured globally, and it's here in the United States. And the sad thing is it's popping up in pills, it's popping up at parties, it's popping up in schools. And that's what we saw out in Park City. Here we have 2 13-year-old boys who fell victim to this. And I was there during that. I spent a lot of time in Park City after these 2 boys died. And my heart goes out to that community. It really does. It just shows you how egregious this is, and it continues to get worse.
Brian Besser, DEA District Agent in Charge, thank you so much for being part of 3 Questions.
My pleasure, sir.